Researchers from Trinity College Dublin, in collaboration with international partners, have uncovered a crucial link between societal inequality and brain health, particularly in aging and dementia. Published on December 27th in Nature Aging, their study titled Structural Inequality Linked to Brain Volume and Network Dynamics in Aging and Dementia Across the Americas explores how structural inequality, such as socioeconomic disparities, affects brain structure and connectivity. The research, led by the multi-partner consortium to expand dementia research in Latin America, REDLAT, the Latin American Brain Health Institute, BrainLat, and the Global Brain Health Institute, GBHI, at Trinity College Dublin, reveals shocking insights into the role of societal inequality in the aging brain. The study identifies a direct link between a country's socioeconomic inequality, measured by the Gini Index, and changes in brain structure, particularly in areas crucial for memory and cognitive function. This includes the temporo-posterior and cerebellar regions, which play a vital role in our cognitive abilities. Researchers discovered that individuals in countries with higher levels of inequality had reduced brain volume and disrupted brain connectivity. These effects were more pronounced in Latin America, suggesting that populations in these regions are uniquely vulnerable to the impact of structural inequality. The findings also highlight how societal inequities can become biologically embedded in the brain, especially in underrepresented populations in both Latin America and the United States. The research reveals that Latinos with Alzheimer's disease experience the most severe impacts of these inequalities, suggesting that environmental stressors linked to structural inequality may accelerate neurodegeneration in aging populations. The study also observed milder effects in conditions like frontotemporal lobar degeneration, which might be more strongly influenced by genetic factors than by environmental factors. One of the most striking aspects of the research is that these associations persisted even when accounting for individual factors like education, age, sex, and cognitive ability. This highlights the significant role of macro-level factors, those beyond individual control, in shaping brain health. The research shows that living in a context of aggregate inequality, where the overall societal structure is inequitable, can affect brain health, regardless of one's individual socioeconomic status. This underscores the far-reaching consequences of societal disparities on mental well-being. Agustina Legaz, PhD, the first author of the study from the REDLAT consortium, emphasized the importance of incorporating both individual and macro-level factors into global brain health research. Our findings emphasize the urgency of integrating not only individual social determinants of health, but also macro-level exposome factors, such as social and physical variables, she said. This research paves the way for future studies that will explore how structural inequality biologically impacts aging and neurodegeneration. Dr. Agustín Ibáñez, PhD, professor at Trinity College and director of BrainLat, also highlighted the significance of these findings. This research highlights the critical role of structural inequality in shaping brain health, he said. As dementia rates rise in low- and middle-income countries, it is essential to target the root causes of brain health disparities, which seem to vary by region. The study also calls for a multi-level approach to brain health equity, taking into account other macro-level factors beyond socioeconomic inequality. These include issues such as governance, air pollution, migration, climate change, and access to green spaces. By identifying and addressing these region-specific challenges, interventions can be developed to reduce accelerated brain aging and the dementia burden, particularly in disadvantaged communities. This study's groundbreaking findings urge policymakers to take a broader view of brain health, considering the impact of societal inequities and environmental stressors on cognitive function, especially in aging populations.